The painkillers are only masking the pain. Ice is definitely no for shoulder pain. Their doctor would suggest doing steroid injection. That again is just to mask the symptom. Most times people with shoulder conditions, even though it's a severe tear and they never had surgery, if they have platelet-rich plasma combined with 25 to 50 million cells in the shoulder injection, one single injection will. So many people have shoulder injuries from playing extreme sports like football, hockey, and because during the sports, the shoulder is a joint that's very easy to dislocate. Because the front part of the shoulder, they only have the tendons to hold the shoulder joint. If the tendon is stretched or there's extreme force, then it's very easy for the shoulder to dislocate. And when you dislocate the shoulder many times, then you tend to get repetitive injury in the area. So that's what most young people playing sports are suffering from. And then when they get older, even though they stop playing the sports that originally caused the injury, they would still have a lot of pain from the scar tissue from the past injuries. And then for most other people who don't have a lot of sports injuries, they tend to develop shoulder pain around age 40 to 50. This is a very typical shoulder condition called 50s shoulder in Chinese medicine. 20 years ago, I actually wrote a blog about frozen shoulder when people reach age 50. And for this type of condition, sometimes people don't even know what caused the condition to start. They just started having minor shoulder pains and then they ignored it. And then over time, it became more and more severe. If they don't do any treatments early enough, they can get to the point that they would have severe pain and restriction in the range of motion. The conventional treatments would be initially steroid injection. Of course, before steroid injection, usually if your pain is not severe enough, they would just tell you to use painkillers and then use ice. After that, they tell you to do physical therapy. And then after physical therapy, if it still doesn't work, then they want you to do steroid injection. And then if that fails, then they would suggest you doing shoulder surgery to repair the damage in the shoulder joint. The painkillers are only masking the pain, and it's not treating any root cause of the shoulder pain. It actually can make you not feel the pain, and then you tend to do movements that aggravates the initial injury. Ice is definitely no for shoulder pain, but people don't really realize that most times. Physical therapy would be an important part for shoulder injury recovery and also the recovery from rotator cuff in older age. But you need to do the right type of stretching. For many people, after months or years of problem with their shoulder issue, their doctor would suggest doing steroid injection to alleviate pain, but that again is just to mask the symptom, because steroid injection is only to temporarily inhibit your immune reaction to the inflammatory response in the shoulder joint that is causing the pain. And the long-term use of steroid injection also weakens the tendon and the ligaments in the joint. So it actually makes your shoulder joint more prone to further injury. You can actually have tear without doing any significant movement because your tendon and ligaments in the shoulder are weakened by long-term steroid injection. Steroid injection is only temporarily alleviate the pain to reduce the inflammation in the area because it's suppressing the immune response. then usually people need steroid injection every 6 months or once a year. I know this lady who's 86 years old. She started having shoulder pain 20 years ago, and she was having steroid injections for the past 15 years. But then eventually it would stop working because she has too much scar tissue building up from the weakened tendon and ligaments in the shoulder joint. And also maybe the inflammation is so bad, even the steroid cannot temporarily mask the pain anymore. Let's talk about PRP, which stands for platelet-rich plasma. That is the procedure that we draw your blood and then spin it to get the upper part of the plasma that is rich in platelets. There are also 2 types of platelet-rich plasma. If you do double spin, you would get more concentrated platelets in the plasma. And I believe in my practice that the double spin PRP is more efficient in treating orthopedic conditions. And you can also find many YouTube videos from other orthopedic doctors confirming that, plus the peer-reviewed articles. So when you use PRP to treat shoulder pain, shoulder injury, rotator cuff, it also awakens your body's own immune system, attract your own body's repair system to travel to the shoulder area so that they can help repair the scar tissue that's causing pain and also repair whatever the tears or any inflammation that's the reason why people have long-term chronic shoulder pain, restricted range of motion, or from athletes who have repetitive injuries. PRP is a very good option. However, when people get older, your own plasma also age with you, just like the stem cells. That's why when you treat shoulder conditions, combining your own platelet-rich plasma with the umbilical cord stem cells will be a more superior treatment to give you better results in a shorter period of time. Most times, people with shoulder conditions, even though it's a severe tear and they never had surgery, if they have platelet-rich plasma combined with 25 to 50 million cells in the shoulder injection, one single injection will make their pain completely go away within 2 months after the injection, and their range of motion will be restored 95 to 99% as well. And even for people who are already in their 70s or 80s, they can also achieve almost 100% range of motion restoration after one single injection with PRP and stem cells. So in my opinion, and also from all my clinical experience, stem cell treatment is an excellent choice for people to recover from any type of shoulder injuries, acute or chronic, and to alleviate any type of shoulder pain for the long period of time, for the long term, and also a better quality of life.